Which of the following is an indication for bag mask ventilation? A. Meconium stent delivery. B. Diaphragmatic hernia. C. Baby is apneic with heart rate less than 100 beats. D. Good respiratory effort at birth with heart rate of 120 beats. And the correct answer is C. Baby is apneic with heart rate less than 100 beats. As per the guidelines, bag and mask ventilation is indicated if baby is apneic and heart rate is less than 100. In meconium stent delivery and diaphragmatic hernia, bag and mask ventilation is contraindicated. Which of the following blood pressure reading should be reported immediately to the physician? A. 130 by 98 mmHg. B. 140 by 88 mmHg. C. 110 by 70 mmHg. D. 138 by 82 mmHg. And the correct answer is A. 130 by 98 mmHg. Among the given value, option A has the highest diastolic blood pressure. Diastolic blood pressure gives best idea related to the risk of heart. Response from a receiver to sender is known as A. Message. B. Context. C. Feedback. D. Stimulus. And the correct answer is C. Feedback. Information sent by sender to receiver is message, and from receiver to sender is feedback. Which is the most important factor in a therapeutic relationship? A. Trust. B. Knowledge. C. Respect. D. Motivating. And the correct answer is A. Trust. Trust is the most important factor in therapeutic relationship. Which is the example of one-way communication? A. Class lecture. B. Group discussion. C. Conference. D. Workshop. And the correct answer is A. Class lecture. Class lecture is an example of one-way communication. Here teacher will take class and students will listen. In other method, speakers and listeners will actively interact. So all other methods are example of two-way communications. When instructing a patient about diet, which among the following would be considered as complete protein? A. Olives. B. Rice. C. Eggs. D. Nuts. And the correct answer is C. Eggs. Animal foods such as meat, poultry, fish, chicken, pork, eggs are the complete proteins. Mention the level of measurement. The following example falls under health status: poor, fair, good, excellent. A. Nominal measurement. B. Ordinal measurement. C. Interval measurement. D. Ratio measurement. And the correct answer is B. Ordinal measurement. Ordinal scales measures non-numerical concepts like satisfaction, happiness, discomfort, and stages of dislikes like mild, moderate, and severe, etc. These responses can be ordered either in ascending or descending order, but does not carry any numerical values. The immunity that is transferred from the maternal antibody to fetus transplacentally and to infant through breast milk to protect them till own immunity system matures to function is a kind of A. Innate immunity. B. Acquired immunity. C. Active immunity. D. Passive immunity. And the correct answer is D. Passive immunity. Which of the following site is recommended for adults as a safe site for majority of intramuscular injection? A. Ventrogluteal site. B. Vastus lateralis site. C. Dorsal gluteal site. D. Rectus femoris. And the correct answer is A. Ventrogluteal site. Ventrogluteal site is considered to be a safe site for intramuscular injection because this site is free from major blood vessels and nerves. Following are clinical features of organophosphorus poisoning except A. Hyperventilation, B. Salivation, C. Pinpoint pupil, D. Bronchospasm. And the correct answer is A. Hyperventilation. The typical features in organophosphorus poisoning includes respiratory depression, hypoventilation, respiratory failure, unconsciousness, sweating, pinpoint pupil and many other like salivation, lacrimation, urination, defecation, gastric cramp, etc. A nurse is changing the central line dressing of the client receiving TPN. She noticed that the catheter insertion site has redness. The nurse next assesses which of the following? A. Tightness of tubing connection. B. Client's temperature. C. Expiry date of bag. D. Time of the last dressing change. And the correct answer is B. Client's temperature. Signs of infection at the catheter site include redness and drainage, so clients should monitor for other signs like fever, chills and elevated WBC count. One of the following is not the general principle of care of rubber articles. A. Dry in sunlight. B. Store in wooden cupboard. C. Fold or roll whenever required. D. Do not use hot water to clean. And the correct answer is A. Dry in sunlight. Never expose the rubber articles in the sunlight and also not to fold them. Only roll them to avoid creases. We can use hot water but not boiling water. Florence Nightingale was born in which country? A. England. B. Germany. C. Italy. D. France. And the correct answer is C. Italy.